Hi everyone, my name is Brooklyn Morrow and I'm here today to present my Convince Me speech to you all. And I just want to give a little bit of a trigger warning that I'm going to be talking about physician-assisted suicide, and if that is a topic that is sensitive or difficult for you, then please don't watch. So with that being said, physician-assisted suicide should be legalized globally. So we first need to talk about what is physician-assisted suicide, or PAS. So it's when a physician provides the patient that is requesting aid in dying a prescription that the patient can self-administer to end his or her life. And the key word there is self-administration. The patient needs to be able to take the pill or drink the drink by themselves. So this should be an option for people who are suffering with severe terminal illnesses only, in my opinion. So the types of assisted suicide, like we just went over, physician assisted, the provider prescribes a medication and the patient takes the medication themselves, the lethal medication. And this is legalized in 11 of the US states. And then there's euthanasia, where the provider would also prescribe the medication, but the provider would directly administer the medication to the patient. And this is illegal across the entire United States and is not what I'm arguing today. So what am I arguing and why? I believe autonomy of death should always be a human right. Physician-assisted suicide should be an option to people who are terminally ill, and terminally ill people only, in my opinion. So in healthcare, patients have the right to make decisions regarding their life, the care that they receive, and I also believe that they should have the right to make decisions regarding their death and when to die, when they're terminally ill. So suffering is inhumane, and PAS allows the patient to have autonomy in their decisions, have great planning, and the ability to say goodbye. So why is PAS a controversial topic? So some would say that it normalizes suicide and that it's a slippery slope to things like euthanasia and PAS for using PAS for mental illness. And again, that is not what I'm arguing today. I believe that that's a different subject. So some would say that it's not necessary since there are good options such as hospice and palliative care, which can equal good pain control. So hospice is similar to PAS in a way because providers do prescribe strong opioid medications to make patients more comfortable, take away their pain, that eventually will slow their breathing and eventually stop their breathing, which expedites the process of death faster than they may have died naturally. And it may question a provider's integrity. You know, doctors take an oath to protect lives, to save lives, not to help. So where is PAS legal in the United States? It's legal here in Maine, Oregon, California, Colorado, District of Columbia, Hawaii, New Jersey, New Mexico, Vermont, Washington, and Montana only under a court ruling. So Oregon's Death with Dignity Act. Oregon was the first state to legalize PAS over 20 years ago, and in order to even request the prescription, there's some, rules, some requirements to be met. So the patient must be 18 years of older, a resident of Oregon. They must be capable, and this is defined as being able to make and communicate healthcare decisions, and they must be diagnosed with a terminal illness that will lead to death within 6 months, which is very similar to hospice care. You have to have a prognosis of 6 months or less in order to go on hospice as well. So once you make your request and you meet all those guidelines, there are some steps to be followed to actually receive the prescription. So first of all, there needs to be 2 oral requests separated by 15 days. So if the prognosis is less than 15 days, this process may be skipped. So secondly, there needs to be a written request, and this needs to be signed within the presence of at least 2 witnesses. Third, the providers, a consulting and prescribing provider, must confirm the patient has a diagnosis and a prognosis of less than 6 months and a terminal diagnosis. Number 4, the providers must agree that the patient is capable to make a decision like this. 5, if the provider feels like the patient's judgment is impaired, there will have to be a psychiatric evaluation. And 6, the provider must inform the patient of all of their alternatives. So things like comfort care, hospice care, and other types of pain control. And lastly, the prescribing physician must request that the patient notify their next of kin of this request. So Craig Ewert's story, I hope I said his name right, but Craig was a 59-year-old American who was diagnosed with ALS or Lou Gehrig's disease. And this is a very devastating, terminal, debilitating disease. So he traveled to Switzerland with his wife by his side because this is where it was legalized at the time, and he did receive physician-assisted suicide. Craig lost his ability to care for himself independently. He could no longer feed himself, dress himself, or walk, and his terminal illness was getting worse and worse every day. So Craig said that he was struggling to live, and he decided when he was ready to die. And his story is available on Frontline if you wanted to check it out. It's about an hour-long video of his story, and it's really touching. So again, autonomy of death should always be a human right. So I believe that unless we are terminally ill, we will never be able to understand why someone would choose to die in this way. Though I believe that we have the right to make our own choices, and that's what this is all about, choices. And with that, here are my references. Thank you so much.